Welcome to The Exam Room with your host, Dr. Rhiannon Winsor. In this podcast, we explore how value-based care is transforming healthcare for the better. From probing today's challenges to charting innovative breakthroughs, we're here to dissect what's shaping the future of patient-centered healthcare. What happens when Medicaid is on the chopping block and health centers are left to fill the gap? In this urgent and insightful episode, Dr. Winsor is joined by Jessica Yanow, President and CEO of the Arizona Alliance for Community Health Centers, to unpack the ripple effects of proposed legislative changes that could drastically reduce Medicaid coverage. They talk about shifting payer mixes, the rise in uninsured patients, and the real-world consequences for health centers, providers, and the people they serve. Jessica brings her deep public health background and practical wisdom to the table with ideas on scenario planning, collaboration, and how adversity is pushing us to innovate in real time. We thoroughly enjoyed this discussion, and I'm sure you will too. Let's get into it.
Welcome back to the Exam Room podcast. I'm your host, Rhiannon Winsor, and today I'm honored to be joined by Jessica Yanow, the President and CEO of the Arizona Alliance for Community Health Centers. Jessica, thank you so much for joining us.
I'm happy to be here, Rhiannon. Thank you for having me.
I'm so excited to have this conversation. I was doing a little bit of stalking on LinkedIn. You are a dynamic, mission-driven leader with extensive expertise in women's health, public health, primary health care, and nonprofit management, skilled in program development, funding acquisition, strategic planning, and board relations. And you also have a proven ability to build collaborative partnerships, manage complex operations effectively, and successfully execute multiple priorities. That is amazing. You have such a wealth of experience and wisdom that I'm looking forward to having you share. What else do you want our listeners to know about you?
What I'd like to share is that my background really is public health. That's how I started doing work in Arizona about 20 years ago. And I've worked with health centers for, at this point, I think it's about 15 years. So I've been in this role for a little over 3.5 years. And I took a break from the Alliance for a few years for a great opportunity at Blue Cross Blue Shield of Arizona. But prior to that, I was actually at the Alliance in a number of different roles for 11 years. And so working with health centers is really my passion. I love our health centers and the work that they do in the communities that they serve. And I think what you would find in talking just about mission, not just with me, but with my entire team, is although we are not the boots on the ground providing direct service as our health centers across the state do, we are very committed to ensuring that everybody has access to healthcare. We are very passionate about that. And so that's how I approach this work. That's what's important to me. And so I think it's important for your audience to know that too.
Absolutely. And, for those that have listened to our podcast, they know that we're an ACO that partners with community health centers, more specifically federally qualified health centers. And so I think this is, a conversation that we need to have. And like I said, it's obvious that you bring a wealth of experience and insight into the evolving healthcare landscape. So without further ado, we'll kind of dive in and we'll see where this goes.
Sounds good.
Awesome. So it's on everybody's mind right now, I think, the current threats to Medicaid impacting community health centers and the number of uninsured patients. Can you speak to that and then maybe offer some practical steps for our FQHCs?
Sure, I will do my best. I think as we speak, actually, there is a bill in the House that is going to make a lot of decisions around what happens for healthcare throughout our country. And so that's really something we're focused on. I'd say one of the most pressing challenges, and this is probably over the last few years, but in the last several months it's increased, is just the instability surrounding Medicaid. What we have been seeing over the last several months in Arizona is, for a number of our health centers, a shift in their payer mix. So we're seeing less Medicaid beneficiaries and more uninsured patients. And so what that means practically is less financial resources for health centers who are still serving the same amount of people. As we talk about what might happen if and when this bill passes, we are looking at potentially a great number of people more being uninsured. And as you know, health centers serve everybody regardless of their ability to pay. It's something that we're really proud to do. We feel that everybody should have access to health care. But as a business, it's particularly challenging to do that when you don't have the financial reimbursement, or that has shifted. And that's what we're seeing with Medicaid right now. And so we're very concerned about that. At a personal community level, what it means is that people either seek care and it's uncompensated, and that puts a burden on the healthcare system as a whole, or people delay care, and that really threatens the health of our communities overall. Often they'll seek care when they're sicker. As businesses, health centers, again, wanting to serve everybody, are having to weigh, how do we continue to serve everybody? What might need to change to be able to continue to serve everybody given this environment? And those are some really difficult decisions. I think that, the other pieces at health centers really are the first line of response in our communities for healthcare needs. They provide outreach, they provide eligibility support, so many services that people are needing beyond clinical care that, again, I think they're being stretched very thin to provide those services when resources aren't necessarily available to continue doing that. You asked me about practical steps that health centers can take. Health centers have been doing a lot of scenario planning as a result of policies that our current administration has put out, as a result of potential bills that might pass. And so they are really actively thinking about, how do we do things differently? We talk about this a lot. You've seen one health center, you've seen one health center. There's no one size fits all approach. I think what we do as a collective at the Alliance is bring health centers together to share best practices, what's working, what's not. And so those conversations are happening too. There's the what's happening in an individual health center and what scenarios are they looking at? And then there's the how do we come together and share an idea of something that this health center did that really changed something about their operations, something about their finances, and what can others learn from it. I think what's hard for this conversation is because of the uncertainty. I don't have a lot of concrete answers of this is the thing, but what I can say is I think some of the ability to weather these changes is going to be based on health centers' ability to think about things differently, to do planning the best they can, even if what comes down the pike is something that they were not expecting, to exercise those muscles around communication with their partners, with their teams, so that they can be as prepared as they possibly can be. But I don't know that there is a singular answer to that question.
Yes, I asked you a very hard question right off the bat. You brought up the idea of collaboration. In the past, when we've had our conferences with our partnering health centers, that's one of the things that kind of comes up again and again is how much they value kind of getting in the same space, whether it's physically or virtually, and sharing those best practices. What are some forums maybe where they can do that?
Yes. So at least for us, as the Primary Care Association for Arizona, we have professional networking committees for a number of different roles or functions at health centers. And so depending on the committee, it could be behavioral health directors, it could be chief information officers. They could meet anywhere from quarterly to monthly. And so we have that happening, and that's been happening for years. So folks can share whatever they're experiencing. They can ask questions of each other. They can learn from each other. We've recently created a C-suite best practices forum. And so we're actually, right now it's twice a year. I hope to do it more frequently, but we're bringing together the C-suites of health centers around particular issues. So there'll be a topic, and you can hear about it from all the different perspectives within the C-suite, because the CMO is not always looking at things the same way as the CEO or the CIO or the COO. And so really thinking about how a team with different perspectives and different approaches can tackle issues together, and then hearing from others as they're going through that too. And then we at the Alliance, actually in July, in a few weeks, our board of directors retreat is coming up. And so that is a great opportunity to bring together, that's the CEOs of all the health centers in the state. We're able to dig in a little bit deeper than our board meetings that we typically have. We meet 10 times a year. And during those board meetings, it's this weird mix of like, here is the fiduciary responsibility of the board and really the organizational oversight. And then also, let's talk about things that are impacting health centers. And somebody has a question of how are you handling this particular issue? So we try to provide as many of those forums as possible. And I know that this is happening nationally, right? As primary care associations, we connect with other primary care associations. And sometimes somebody has a question at one of our health centers, and I can't find another health center in Arizona that's able to answer that question. I do reach out to my colleagues in other states to say, do you have a health center that has been in this situation? And how can we connect folks? There are those opportunities. Again, because of the you've seen one health center, there is no one size fits all. So even when somebody has a great thing that worked for their health center, we absolutely want to amplify it. It doesn't necessarily mean it's going to work for everybody else.
Absolutely. So those resources that you're talking about, can they find those on your website?
They can. They can also just reach out directly to me. We can get them connected to the appropriate committees.
Awesome. Yes, collaboration is so important. I think another thing that kind of came to my mind while we were having this conversation is the ability to adapt and pivot quickly. It makes me think of when I was managing a healthcare program for an allied health institution and COVID happened. And we were a residential program on ground. All students came, and it was a very hands-on. That's what brought the students to us, right? Was they wanted this hands-on experience. And now we're at home or online. School is closed. I feel like the institution did a really great job of pivoting in that situation. They just really rallied together. I think we did a good job of getting our arms around the students, but that's really hard. You know, the bigger you are, it's like a big ship trying to make a U-turn, you know? So, you know, as far as change management, flexibility, adaptability, those kinds of things, and doing that with less resources than we've ever had. Any advice there?
Sure. So, you know, I think what you said, Rhiannon, about we were able to do it and we just needed to do it differently. I think whether it's the pandemic or whether it's now and we're responding, and maybe I'll talk about the pandemic for a second. So, you know, when the pandemic happened, many health centers had implemented some level of telehealth. It was a priority for them, but for a lot of reasons, it was not something that had advanced very far. And the pandemic happened, and all of a sudden it became an imperative. And like overnight, health centers found completely different ways to do things, implemented huge telehealth programs that are still functioning today, right? And so I think that the only piece of advice I would maybe offer around that is that challenges and uncertainty can breed great innovation. And I think to get to that place, it is incumbent upon leaders to think about not necessarily how things should be, but just where we are right now and what we need to do to adapt. So I think it's letting go to some extent of some of our preconceived notions of how things should work, how we'd like them to work, and instead saying, this is the situation that we're in. We recognize it's not what we expected, and how do we respond in this current moment to whatever's happening? And I think to go along with that, as you talk about change management, it's not just okay, we're going to make this pivot. There's so many people involved. And so it's how do you communicate throughout the process? And you can communicate that there's uncertainty. I think that's really important. There's a lot of things right now where our health center leaders, where myself, we don't have the answers. We don't know what's going to happen next. But if you can bring your team along to understand this is where we are now. These are the things we're thinking about, and we are going to have to respond, and it might not look any way that we expected. I think those are the first steps you can take. It doesn't, I think what's really hard right now is that, when I talked about scenario planning, there are so many possibilities that it's not possible for folks to plan for all of them. And so what could come to us is something completely different than we expected. And again, I think being in that moment to say, this is where we are, is not what we planned for, but because we did that planning, we flexed our muscle around how we respond, and then taking that to move forward.
Yeah, it's hard too, because we usually plan for the future based on what's happened in the past.
Yes, I will say this up front. We are a nonpartisan organization. We don't advocate from any particular lens other than we want to make sure that health centers are sustainable and that communities have access to health care. Whether it's an executive order or policy that might impact health centers in some way and impact communities that are served, we analyze that. We think about what does that mean? But we were told pretty early on, and I think it has been a hallmark of this administration to want to change things up. So we were told very early on, just because things happened a certain way in the past, you can't give any stock to that at all. And that is a hard place to be in because you can't then predict what happens next. As I was planning for this conversation, I was thinking a lot about how we want to be as leaders. Of course, we need to respond to whatever comes to us, but the desire to be proactive and be planning proactively for the future. I think many of us have been swept into this environment now where pretty much the majority of what we're doing is reactive. And that's not the place that you want to be in, but we also don't have a choice right now, so we are just going with it.
Yeah, those are all really good points that you make. So you mentioned a couple times about scenario planning. Do you have any examples that come to mind of scenario planning that's successfully led to a shift or a pivot or success of some kind?
That is a great question. I don't know that I have a particular example right now. I'm certain that we have health centers that could share things that they've done. What I would say is that right now what is happening is there's questions like, what if Medicaid membership drops? What does that look like for us? What happens if we lose X percent of our workforce as a result of those drops? What happens if federal policy changes on an issue and we're not able to see X percentage of our patients? And so I do think that as some of these changes have already started happening, have been making decisions to ensure that they are sustainable. And it's unfortunate because some of those decisions mean reductions in force, mean really assessing the services they're providing and saying, is there somebody else in the community that's providing this, and should we be spending our resources doing that? And so in terms of creating sustainability, those sometimes really hard decisions that health centers are making are doing that. I think the question is always at what cost, but if health centers don't exist, then there isn't anybody to provide services to many of our communities. And so the sustainability piece is really the key. So I guess to answer your question, no, I can't think of a specific scenario planning activity that's led to a measurable change. I am sure they are out there. And what I do hear about every day is health centers looking at their operations and their finances and discovering things like, we could do this thing differently in terms of billing, we're not doing it correctly, or our process there's a flaw in the process, and finding huge gains because of that. Or it's the same thing with workflow, like looking at workflows and saying, oh, if we did it this way, then maybe we could save these dollars or these resources or dedicate this staff member to something else. And so those are the things that we see every day, regardless of what's going on in the external environment. And those are, I think, really great changes that health centers are always making to be sustainable.
Yeah, and it sounds like that paradigm shift in just the way we're thinking. In healthcare, change is always constant, but we don't like it. And we've been doing it this way for all of this time. And it's scary to try something new, especially when there's so much on the line, our patients. I can understand that, but automating processes, it seems like refining workflows as much as possible seems to make sense.
Yes. I mean, I know we have health centers that are using AI in lots of different ways. One of the ones that for some of our health centers really seems to be having an impact is for scribing and reducing the amount of time that providers are needing to be doing that. And that is making a difference, both operationally and then also just with provider satisfaction as well.
Yeah, I was just listening to a webinar about how some different health centers are applying AI. And one of the things that they were saying is that they're using AI to help them prep for their, meeting with their patient. Mm-hmm. And it also, AI is able to pull from all of these different resources to give them this big picture of the patient so they don't have to spend so much time prepping. And then with using the scribe, they just hit record, they sit down, they can have the conversation that they need to have with the patient. And then the patient feels more engaged too, I would think.
I think so. I think the opportunity with AI is that it's not going to be perfect, right? You have to teach it. And so I think folks do sometimes get frustrated, like, oh, we tried this and it's not doing it for us. And the question is, how much time do you need to spend to teach it what's needed? But for the folks that are using it successfully, they're really happy with it.
Perhaps, one of the silver linings to all of this and what's happening with the, legislation and all of this is forcing us to be more innovative, in our approach to treating patients.
I think that's true. I was not at the Alliance during the pandemic. I was actually at Blue Cross Blue Shield during that time. And so I came back to the Alliance at the end of 21. We did a board retreat 6 months after I came back. We had a whole discussion about what were the silver linings of the pandemic. And the thing was, it was a really difficult time for everybody, regardless if you work in healthcare or not. You work in healthcare, that's an added layer. You're leading a healthcare organization, that's an added layer. And we saw some retirements after the pandemic, right? But to actually talk about the fact that it did breed innovation and there were some positive things that came out of it, it's okay. It's okay to do that. It doesn't mean that it wasn't hard. It doesn't mean that folks aren't still recovering from it. But often when you're in a less resourced environment, when you're challenged in ways you haven't been challenged before, you have to think about doing things differently. And so I do think that's where we are right now as well. And this bill is most likely to pass, and it is going to have a tremendous impact, not just on health centers, but on our healthcare system in Arizona and in the country. We will have to think about how to do things differently if we want to be sustainable.
Mm-hmm. Yeah, I love how you brought up, what good things, kind of came out of this horrible situation. I'm stuck on this book right now. It's called Anti-Fragile. And that's the whole premise. He talks a lot about it. It's the opposite of fragility, anti-fragile. There's really not a word for it, so he kind of coined this term. But he talks about things like war and the bubonic plague and those kinds of things, and these really horrible things that happened, but the positive change that grew out of that. Yes, it's horrible. There's loss and there's hurt and all of these things, but it forces us to grow and shift in ways that we never would have if those things didn't happen.
Yes, I agree with that. I still, first of all, I love the bubonic plague as an example because I have a strange fascination with the bubonic plague. But I think that's true. I wouldn't wish the challenges that the healthcare system is currently going through on anybody to bring about change. I think it's just the reality, and it's probably going to get a lot harder before it gets easier. But I do agree that adversity does breed innovation, and it would be nice to not have to have the adversity, but that's just where we are.
One of the things you said made me think about the importance of trust building. And we think about, a lot of times we think about building trust with our patients. That is very important. But I think that culture of trust needs to start within the health center. You talked about transparency and those kinds of things where I think in healthcare, it's a traditional kind of top-down approach where, I report directly to you and then you report directly. And so I go to you and then you go, and it kind of goes up the flagpole. But can you talk a little bit more about maybe what health centers can do to foster trust, just, cultivate that culture of trust, with their staff?
So, I think you touched on it, Rhiannon. It is the communication, it is the transparency. If people develop a sense that what you are saying to them is true, they can trust what you're saying to them, they are much more likely to then say, in that moment where you're like, I don't know what's happening, but I am going to commit to doing the best possible things I can for you all in the organization, they are going to buy into that. But it takes time, right? You can't just show up and say, okay, this is the stuff and now you should trust me. I think the other piece around trust for many people that's critically important is the walking the talk. So if you say you're going to do something, actually do it. If you say you're going to do something and it doesn't work out and here is why, talk about why it didn't work out. I think there's a level as leaders, the ability to be vulnerable and say we tried that and it didn't work and here's what we're doing instead. But if you bring people along and let them see that vulnerability and, again, do what you committed to doing, that goes a long way and people are willing to follow you. And I think the reality is as a leader of an organization, like, it's never a perfect situation. You are always going to, no matter how much you do to foster trust and relationships, not everybody likes management. Like, it's a hard job. But if you can bring the majority of people along with you, and again, it is being open. And I think that's really hard too in a larger organization. We have some health centers that are, really large. That's even harder, right? Because as a CEO, maybe you don't get to see some of your staff ever, and you don't get to develop a personal relationship. But I think, again, that's why the communication with your leadership team, making sure everybody is on the same page and on board with how things are going. And I think, if there's conversations where, among leadership, folks need to challenge something, having that in a closed room and then coming out of the room and saying we are all on the same page and this is how we're moving forward. The two biggest things would be the communicate transparently and follow through, do what you say you will do. And maybe the third one is, live by your organization's values, demonstrate that. Because if you're not doing that, people are not going to trust that they can rely on you for other things.
Yeah, being listened to is a huge part. Cause like if you're like one of the things you said on one of the other podcasts is like listening to understand. And when you have those people that are more on like the frontline level that can talk to like what it actually is to like work with patients and like see what kind of like that experience is and like being able to like bring it up. Cause like if we think about like executive levels, there's usually only like 5 brains that are part of that, you know what I mean? And so like if you can think about like, oh, we have all these other wonderful people that are actually like care about our patients and want to help them, that enthusiasm and actual concern and care that comes with caring for patients, bringing that more up to the upper level where those people can kind of like hear and understand what's going on there. It's like a really wonderful feedback loop that can kind of like help get everybody on board, as opposed to like that top-down dynamic, which in my experience hasn't worked very well.
Well, and I think, too, just in general, again, it depends on what the scenario is, but in general, the more brains in the room, the more good ideas. Mm-hmm. We all have different communication styles, but in terms of leading teams, it's the understanding that not everybody responds to the same style, so you have to adapt. Mm-hmm. You just have to. You might have the same conversation with two different employees in two completely different ways because you know what they need, even though maybe neither one of those ways is completely the natural way you would do it if left to your own devices. And I think that's okay. Like, that's part of working with people.
Yes, absolutely. I know years ago I was having a phone interview, and it was with the dean of this institution, and she was asking me a bunch of questions. She said, okay, well, I only have one more question for you. And I'm like, okay. And she says, how do you like to be managed? I don't know. You stumped me on this one. Nobody's ever asked me that before. Like, what do I need, And so, that was a totally different perspective that I incorporated moving forward. Like, she really modeled the behavior of she would manage, lead, whatever. She would lead me in a different way, in a personal way, than anybody else on her team. And that was really appreciated for sure.
Love that.
Yeah, me too. She was one of my first mentors, I think. She was really awesome. She modeled the behavior. She was transparent about things. I felt like I could go into her office and be like, look, I screwed up. Here's what I did. And, that it was a safe place to do that. And I knew that she wasn't going to be like, get out, don't ever come back again. That she would help me work through that. So,
well, I think when we're talking about trust, I think that's another component too. Is it's not just about the messaging and the walking the talk, but it is about providing a safe space where people can learn and grow. And I think if people feel penalized because they can't learn or grow or make mistakes, that also breeds distrust.
Yeah. So going back to your mention of the importance of communication, we talked about collaboration, those kinds of things. I wanted to pick your brain about, are there any innovative communication platforms, things that health centers could do without utilizing a lot of resources that would help them facilitate communication during this time and moving forward?
So I think it's very much dependent on the health center. They each have different ways that they communicate. I can think of a few of our health centers that have, they're larger, that have either a weekly or bi-weekly video that the CEO does that goes out to all staff that talks about whatever the current issues are. It could be anything from the financial wellness of the health center. It could be related to advocacy. It could be, these are our priorities this month in terms of clinical outcomes, what we're trying to achieve. And I've seen that be really successful. The health centers that have done that have gotten that down to a science of we know that they only watch X number of seconds before they tune out. So that's where we need to have this information. We do have health centers that do town halls. And so they'll go to different sites because they can't necessarily get all of their staff in one place. And the CEO and the leadership team, they'll do a town hall, either over the course of one day or the course of a couple days to update everybody. For smaller health centers and, even for us at the Alliance, we've had some changes recently as a result of what's been happening at the federal level. And I have found even just a weekly or bi-weekly update of here are the things that are going on, here are the things that we're looking at right now via email has been really helpful. Again, depending on the size of the health center, it may not always be the CEO who is the one who's saying my door is always open. In the case of our organization, it is because we're small. But I think having those, whether it's the CEO or other leadership team members whose door is open for those questions too, is really important. And I think the other piece I would say that I think is really important is making sure that the leadership team is on the same page about whatever the issues are before distributing it out to all staff, so that there is a united front, united way to respond, that the communication is standardized to some extent. Those are things I think that are helpful. again, it depends so much on the health center, but I think transparency at whatever level is appropriate, right? There's things that can't be shared with everybody all the time, and that is fine, but transparency to the level that's appropriate. There's always going to be confusion, especially as there are rapid changes and we're needing to respond to them, but anything we can do to reduce that and help folks understand, we talk about this a lot at the Alliance, the why. Why are we having this conversation? Why do we care so much about protecting Medicaid, for example? What does this mean for us as an organization? What does it mean for our health centers? What does it mean for patients? Why is this such a key priority? And it was actually very interesting. We did some work with our team at the Alliance, and everybody could identify that during this time that protecting Medicaid is our number one objective above all else. They knew it was really important to us in our health centers, but not everybody could explain to a family member why that was important. And so that was an aha for us of like, especially in a leadership role when you're doing this work every day, it's so critically important to you, but taking a step back to say, what might people not understand about this that would be helpful for me to share? Yeah.
I have a quick question.
Yeah, please.
So I am from a big artist community here in town, and a lot of those folks are on access. And so me working here and kind of hearing like the way that things are happening in the health centers and all that, and like I'm like, yo, you might want to contact some representatives to let them know what's going on, because it can absolutely affect your health care. And it's something everybody kind of can take for granted sometimes, like when they have it available to them, they utilize it and all that, but like when the threat of that is like going to completely destabilize how these folks get health care, it's got like, you have to like open their eyes and see how it actually affects the people in your life, and as opposed to like just this vague insurance bubble that it can tend to be.
That is absolutely true. And I think so interesting too that you say that. Even so, you're talking about artist community. I went and spoke at a panel around protecting Medicaid, and it was for our Arizona Medical Association. And so there's all these doctors there. They're not affiliated with a health center. They work in any kind of practice. And they were like, how do I get plugged into this? And so I think that was an aha for us. Like, we have a network through health centers where we're sharing all this information, but does it get down to the boots on the ground staff? Does it get out to the community? I don't know that we always have control over like how the message goes once we give it out to the health centers, but I think that once people become aware, they're like, oh, I need to do something about that. But they don't necessarily even have the knowledge of like, how do I go about, like, many people haven't called their representative ever or sent an email. They don't know that's an option, or even if it is an option, they're nervous about doing it. So I think those are all very valid things. And I don't know. It's a much broader question of collectively as a country, how do we mobilize around issues that are really going to impact people's health and well-being? And I don't have an answer to that. But I do think that education piece, that piece of you saying, hey, at work I'm hearing about this stuff and that's actually going to impact all of us, and here's something you can do, that's where it starts, right? It's the letting people in your environment know, hey, this is going to impact you. And even if it's not going to impact you, it might impact your neighbor, your mom. And so like the changes we're talking about with this bill, like nobody comes out of it unscathed. It's not just about Medicaid. It's like, because of the reduction in Medicaid funding that will happen to many healthcare organizations, they will not be able to provide the same level of services, and that impacts everybody, even if you have great employer-sponsored insurance. I'm glad you brought that up. And I think it is a real need, and I don't know. We work with so many different entities that do that advocacy work, but I don't know how you get the community at large engaged, and that's tough. I would say, Rhiannon, to your question about like, what do you do? So I'll tell you a little bit about like what happened at the Alliance that was a great learning experience for us. So we were having it was a leadership training. It was just for directors and above at our organization. As one of the activities, what we did was talk about priorities for the organization. And so everybody who was in this meeting had to list on a flip chart, these are the 2 most important things that I'm working on right now, whatever it is. So if you work on a particular program, it might be your reporting for that program is the most important thing right now. And of course, just because of my role, the things I'm thinking about are the more strategic. So one of those was protecting Medicaid, along with my external affairs team. That's what they're focused on. And so after that, the facilitator had us go around and mark off, like, everybody had a vote. What are the two most important things to you? Like, the two most important things to the functioning of our organization and our health centers. And everybody marked off protect Medicaid. And so it led to this conversation where it was like, okay, protect Medicaid, but what does that actually mean? And what came out of that is that and people were very vulnerable, which I really appreciated. People don't always have an understanding of what they, at a nonprofit organization, what they are able to do and not do at work in terms of advocating for legislators to do a particular thing. People didn't necessarily have the tools to explain to their family members, like, I know this is important to my work, but here's why you should care about this, even though they knew it was important to care about. People were nervous about calling their representative, and even if they had a script, felt like if we could just set some time aside where, like, we could be together and support them in doing that, that would be helpful. I think the other thing we learned was that, especially not for our team, but for family members or friends, is that typically you get this alert and it's like, we need to call today, right now. And so to start having those conversations in advance, like, we're going to be sending out an alert. Here is what's at stake. We don't know exactly what the timing will be, but this is what we want you to know to prepare you. You know, we're getting direction from our board of directors. It's the CEOs of health centers who are obviously very engaged in this work. It is not necessarily always their policy folks we're having those discussions too. And we're having those discussions and gathering that information as well and trying to incorporate it. But I think being able to have that discussion with our team and then take it back and say, this is what we learned from it and this is what we're going to do differently in the moment right now as we're advocating, that was really important. Because we could have just said, oh, this all works great and we're just going to keep pushing forward, and we wouldn't have had a different response. But I think the other thing that we're seeing is happening nationally, and I think this, Benj may also speak to, like, the communities that you're engaged in as well. It's not apathy. It's people are so exhausted from having to advocate for so many different things that we just don't see the kind of grassroots response that several years ago we would have if there was a national call to action around things that might impact health centers. And I think depending on what, everybody has issues that they're really passionate about. So depending on what your issues are in this political environment, I don't think it necessarily matters like what side of the aisle you're on. There's going to be something happening that's going to rile you up and people are upset. And so that's the other thing we're finding that I don't know how to break through, because that's something that's happening on a national level. When we talk with our partners in other states, it's the same thing, is that it's like you can't give up on these things. It doesn't matter how many times I've called my legislator's office, I will do it again. It doesn't matter that I know that he has publicly stated he is going to vote for the bill. I still feel obligated to call, but it's disheartening and it's demoralizing, and people just kind of get to this point where like it's not going to make a difference anyway, so I'm not going to do it. And I don't know how you change that, because I fully understand it. It's just I'm not in a position with where I'm sitting professionally to be able to make that choice.
Yeah, it's so hard to, like, if you don't have somebody to rally behind that is like advocating for something, like especially with like healthcare, because that's one thing, like I've even been really bad about advocating for my own healthcare.
Yeah.
Because it can be kind of abstract, and like because of like the models that we have like kind of been geared toward, like with fee for service, where it's like, oh, I'm just going into this factory where I go and I see this person when I'm sick, and then that's the transaction that takes place or whatnot. But because of the way our health centers are kind of focused around value-based care and like what that actually means for people in that community, like where we're looking at social determinants of health, we're looking at like how these people actually get access to things. When you get more of a perspective of that and you're able to share that with other people, like, hey, I don't know if you're aware of this, but like we all get old. Getting old is scary.
Yeah.
And like some of our folks are like extremely rural, and like when you're in the city, like you don't like start taking into account like, oh, I have like friends that live in Oracle and like friends that live in Globe, and like those places are very, very underserved. And when we start looking at like how this can trickle down, kind of what you were speaking to is like there's a reduction in workforce. There's also the possibility of like hospitals closing, and like there's all this, like there's this huge ripple effect that affects all of us. And it's so hard to let people know that we're all in this together, because there are those partisan divides. There is like kind of the overwhelming thing where like I might be getting in the weeds here, but like I think so much of what has happened is it's focused on culture war as opposed to like how this all affects like different people in different classes. And if we were able to approach the problems like with how things like Medicaid are going to be affecting everybody with empathy and awareness, it could go a long way.
I agree with you. And I think what's so interesting during this process around this bill that we've found is that we did polling, and what resonated more than all of the data, I mean, there's reports showing the economic impact for Arizona if this bill passes, and they're dire, but that's not what resonated. It was the personal stories, that talking about the family that relies on Medicaid and what that means to them and why they rely on Medicaid and what would happen without that. Those are the things that resonate, because it's real people, right? Like I think when you vote for a bill that's this abstract thing of like we're saving these dollars and this is great, but when you have to say, yes, I voted for that, and now these millions of people are not going to have health care, and I'm totally fine with that. That's something a little bit different. And what does it really mean when people don't have access to health care?
One of the things that I like encountered in talking to friends and people in the community is how this impacts folks with disabilities, because a lot of our people in our communities do have disabilities that rely on Medicaid. Their families rely on Medicaid to help get those people care. And when we look at like, okay, like if we're subtracting that from those folks, what does that look like for not only the people that have been taken care of, like our CHWs, our caretakers, the physicians that help those people? Like, we're leaving a lot of families that are very vulnerable in the dust. So like, with that being said, what are some ways our health centers can better advocate for those patients to advocate for themselves? Like we've talked about trust and communication. There's this concept of like what we call wise mind, where you have like your emotional side that you can like kind of relate and have empathy and all that, but then there's like the logical, rational engineering type brain that goes into it. And communicating with wise mind with our patients and our people at our health centers, like what are some of your thoughts about like how this impacts some of those folks?
That's a great question. And I will say that as part of the advocacy efforts, and it's her story, it's not my story to tell, but our Chief External Affairs Officer uses a wheelchair, and during a previous time where there was reduction in access, lost her coverage completely and was very lucky to make it through that. And I don't know that folks will be so lucky this time. I think something that health centers are really good at is knowing what resources are available in the community, knowing who to talk to, reaching out on behalf of patients to get needs met. And I would hope that would be able to continue. But in terms of guidance for both the health centers and the patients, I would say there needs to be a partnership. There. And if the health center is already a trusted provider for someone with disabilities, they should continue to rely on that health center as a trusted provider to help them navigate. It's not the ideal. And again, I think as resources are further stretched, I do have concern about whether the health center will have capacity to do that. But if folks have built this relationship, that leverage it, continue to leverage it. I don't know that I truly answered your question, because I don't think there's a good answer.
Speaking of resources, like a lot of our health centers do have those types of things where like they can reach out to like for like food, transportation, all of those things. For people that are outside of the health centers, like, do you, like, with you being like the alliance for those folks, is there like a collective resource that these folks all have access to?
So part of the reason health centers are able to do that is because of the strong relationships they build in the community, right? So each health center, whether it's online or they have a notebook somewhere, has like, here is the list of who we have that can help our patients with X, Y, or Z, and we can refer them or we can make a phone call. And I've worked with health center staff before that like just know everybody in their community. Like, you need anything, oh, I just called that person. Oh, I just got this for this person. And so that's a very typical thing. I think when you are a patient at a health center, you have access to all of that. If you are not a patient at a health center, our social service systems and healthcare system are incredibly complicated to navigate. And so there are, you can call, for example, AZ211 is a line where you can get information about different services available throughout the state, and folks do that. And I could be wrong. There might be within the social service community like one resource that people know of, but as far as I know, 211 is how you find those resources. Well, and we have, like, through work we've done with health centers, we have a link to Find Help, which is a website where it populates all these different social services, and our health centers can use that. They can actually give it to their patients to utilize as well.
One of the biggest things, it seems, is like lack of transportation. I can't get to the health center, or the health center is too far away, and it's hard to travel there for some of our folks, where telehealth could be, a good way to, kind of bridge that gap. So I think, again, it goes back to that out-of-the-box thinking. Kind of seems like there's a lot of doom and gloom. And,
It's a hard week this week.
It is hard, and it's scary. And what's one takeaway you'd like our health center leadership to have?
I think the one takeaway is we can get through this. I think that is it is very intimidating right now. There is a lot of uncertainty, and it's not going to be easy, but I think the commitment that our health centers have to each community in the state is not something that's replicable. It is such a unique and important thing. And so I don't know what changes will need to be made. I don't know what it will look like a few years from now, but just to not give up. We're stronger together. Our communities are relying on us. As part of that too, the stronger together, whether it's in terms of doing the actual work or whether it's in terms of just supporting each other and being there for each other, I think that those are all important.
What's the biggest takeaway you would give to patients that utilize our health centers?
That your health center is still here for you, despite these challenges, that they are a resource, that you can continue to rely on them. And I think that's the really important piece, is there's a lot of, not necessarily misinformation, but concern around what this means, and we don't have all the answers. Don't give up on your health center, I think, is a really important one, and your health center is not going to give up on you.
I think we've had an amazing conversation today. Jessica, thank you so much for coming to talk to us about this. Are there any other resources or anything you would like us to put into the show notes for listeners or anything like that?
Yes, everybody can go to our website, super easy, www.aachc.org. I imagine most of your listeners might already know me, but I'm happy to share my email too. It's jessicay@aachc.org. Also super easy. If I'm not the person, I can connect you to the person on my team that can help you, but I'm always happy to do that or to have a conversation. We really just are here to support health centers in the state. And I will thank you both, Rhiannon and Benj, for having me here today. I've loved our conversation. This has been great.
Me too. It's been fantastic. Thank you so much.
Thank you for joining us in the exam room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation was as insightful as your last checkup. A big thank you to our guests for sharing their expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. Until next time, take care and thanks for listening to The Exam Room.